Radioisotopes can simply be defined as atoms that contain an unstable amount of neutrons and protons within their nuclei. They can be used in medicine as well as industry. A specific radioisotope, Iridium-192, is used in both these areas and emits beta and gamma radiation. Beta radiation is made up of beta particles which travel at 99% the speed of light. They can penetrate human skin as well as damage living tissue, but can't penetrate thin layers of plastic, wood, or even aluminium. On the other hand, gamma radiation is made up of electromagnetic waves. The gamma rays, having no mass, travel at the speed of light and can only be stopped by a thick layer of lead or concrete. Furthermore, in the medicinal area, Iridium-192 is in the form of tiny seeds or pellets sized around that of a grain of rice. It deals with nuclear medicine, specifically brachytherapy. That is, it is used through the radiotherapy of cancer, in which brachytherapy is a form of treatment where the radiation source is placed either inside or next to the area of the patient receiving treatment. It is effective in treating cervical, prostate, skin, and breast cancer. This treatment is in the form of implants, in wire form, and is inserted through a catheter to the targeted area. There are several advantages in using Iridium-192 in medicine. Not only has it proved to be cheaper in its use in brachytherapy, but it also gives us less overall radiation to the body in comparison to similar treatments. There are also very limited side effects in using it, and is evidently more localized to the particular tumor. Additionally, a very small source of Iridium-192 can provide a very high dose rate, meaning that only small sources of it need to be used. Also, its use in brachytherapy allows for a minimal effect on surrounding healthy tissues. On another note, it can be quite hazardous. Due to its high energy, gamma radiation, prolonged exposure to it can increase the risk of cancer. Internal and external exposure can also cause burns to the skin, stomach, and intestines, as well as radiation sickness. Internal exposure could only occur if one were to swallow Iridium-192 pellets. Therefore, the advantageous aspects of using Iridium-192 in medicine far outweighs its disadvantages. Although it can cause sickness, burns, and may even increase the chance of cancer, these can be controlled by cautious handling and ensuring minimal contact with it. Whereas, the benefits of using it is quite unique. It's cost-effective, kills cancer cells whilst inducing minimal damage to surrounding tissues, gives off less radiation to bodily fluids, and doesn't need to be used in large quantities.